tomorrow's a Friday. What's a normal
Mhm.
Friday like?
So I do home health. I'm in the city of Buffalo, so I usually see 4 or 5 patients that day because I have to do a start of care, which is a longer evaluation, OASIS documentation. There's a lot of documentation that goes into an evaluation like that because you're not just looking at the physical therapy condition, you're looking at the overall health of that person. So a lot of data you have to collect, including medications, understanding their whole health history, understanding mobility, what type of assistance they get and whatnot. So that's the evaluation to do on Friday, which those evaluations take a little bit longer to do. But then I'm also seeing a few people based off of whether they need to for regular evaluations or discharges or visits. So I have a few of those scheduled in the morning. Then I take the time and do my chart review to get my starter care going in the afternoon. So those type of patients could be anywhere from just general deconditioning, got out of hospital for, a number of different reasons. They fell or they got, pneumonia, the flu, what have you. Or they could be, a stroke where they are trying to work through spasticity on the affected side that the stroke caused. They could be working through diabetes where they have portal neuropathy, like I mentioned earlier. They could have congestive heart failure where their heart is not pumping efficiently like it was before. They need to work on their conditioning and try to do the basic stuff like walking around their home, getting up and down stairs safely. There could be a number of different things. So you have to just be able to be ready to know what you're walking into and know what kind of things you want to address with that person that day. And some days are real productive and others not so much, but you're working with people typically at their worst in terms of health, and you're trying to build them back up, and you're seeing a lot of different stuff every day, which means you have to be well versed in what you're looking at.
So you're headed to them.
Oh yeah, yep. I go in their homes, and I'm in some absolutely beautiful homes and some not so beautiful homes. But everybody thankfully has a home, and unfortunately we have people, that their home situation is fluid. I'll put it. So we have sometimes have to get creative with how we see them. So, for example, city mission, and we unfortunately do get people in those situations that do new therapy, and we just have to find a way to come to them and try to give them the care they need because healthcare, I believe, is a right and not a privilege. So you should be able to still get healthcare no matter where you're at.
You must see a lot as you
Oh yeah.
as you venture from that. As you said, you work with folks. I believe City Mission, if I'm remembering correctly, that's a homeless shelter, correct?
Mhm.
I, I what stands out about working with that population?
Those people they can be vulnerable. I'm not saying that they're just at a real vulnerable time in their lives because a lot of us grow up having a home, something over their heads. We know where our food's coming from. We know where just kind of some stability. Those people have had everything ripped out from underneath them, and they have pretty much nothing. They might have the clothes on their back and maybe a few belongings, and they have to go seek assistance and get health care and food and a roof over their head and just try to find some stability. And unfortunately, there's a lot of mental illness associated with that, and sometimes life just kicks people when they're really down and they're living in their car, and then they get sick and they have to go to the hospital, and just there's a lot of different situations I've had working with some of those people in that, men and women, and it just life sucks sometimes, and I'm glad that is kind of a safety net there so they can at least get back on their feet. I have seen success stories where people get out of a situation, they get their own apartment, and they start kind of building themselves back up there. So it's just you have to be mindful of what they're going through. Like as I mentioned before, you're dealing with people at their worst with their health, but in this case, with dealing with the homeless population at times too, you're also dealing with them not only at their worst with their health, but financially, socially, everything else like that. So you have to be mindful of what you're asking them to do and just try to get them up and moving again so they can at least stand a chance at getting back on their feet, literally and figuratively.
It's so interesting. Your work takes you from one extreme to the other.
Oh yeah, I've been in multi-million-dollar homes and I've been in, literally nothing. But like I said, healthcare I feel is a right, and everybody should have an opportunity to at least have some basic level of healthcare to at least try to keep them moving forward.
Has something on the job cracked you up?
Cracked me as in laughing, or cracked me as in like emotionally.
How about both?
Oh, I've had funny moments. I mean, you meet some incredibly interesting people and you just have good laughs. And I think that helps break the ice of sometimes people are dealing with some really crappy health diagnoses. And if they have a good sense of humor about it, you can have a really good laugh with them. Or sometimes people are just really engaged in, hey, I want to get better. I'm going to give you my effort and my my willingness to work with you in order to help me get better. And I've had some really cool experiences where you see people where they really kind of low in terms of mobility and get them up moving around again and just kind of say, hey, I helped them do that. That was really cool. So, and you have some laughs along the way because you get to really know these people, working with them for, 6 months, sometimes a year in rare cases, even just a few months. You really try to get these people built up. And also cracking from a emotional standpoint. Sometimes you see some really rough cases. I'm not going to go into specifics with them just, for privacy, and not that that would give away anything, but still there's just a level of, hey, I'm not going to go there with that. But just some things I'm thinking about right now, it's just like, man, how sometimes you read the background of these people, or, sometimes the social histories of them, or what they're dealing with, and then the social aspects of that. Sometimes people are just in a really tough spot, and you're just like, I don't know how I would be in that situation if I was presented with that. Sometimes it's, the health condition and then their family around them, or sometimes the living situation. And it can kind of just really make you question a lot of things. I don't want to say you have to become detached, but in a sense, you're there to do a job, and you want to just try to make sure that you don't want to get too emotionally involved, because sometimes it can be tough to pull yourself out of that. And I think any healthcare provider would say a similar thing, looking at some of the situations they've worked with over the years.
My girlfriend's a nurse.
Okay.
And she's expressed similar things, that some, you kind of have to build a bit of a callus.
Very much so. Very much so. And it's not even like you don't want to be empathetic, sympathetic, to their situation, but sometimes you have to just say, hey, I'm here to do a job. I'm here to help you get better. And, I hear you. I understand what's going on, but know that you kind of distance yourself in order to do the job. Because if you get in too deep, then it's really hard to kind of really look at the entire forest through the trees, if that, saying is correct there. But sometimes if you get too deep in with these people, you really lose focus of what you're trying to work on, and then you become part of their problem instead of part of the solution.
And just listening to your description of your day, you're not giving an entire day to one person. You have to you have to move on to the next case.
Absolutely. So sometimes you have a really tough case, and whether it's emotions are flying or they just were very difficult to work with, sometimes you have to hop in your car, take a break for a second, and then find a way to move on. And that can be the same thing as if you're in the hospital, or if you're in, the nursing home, outpatient clinic, what have you. Sometimes you have to just step back and say, okay, on to the next thing, and just kind of keep moving there. Then maybe you process it later. And it's not saying you stuff down your emotions, but sometimes you have to say, hey, I got to keep moving along, and then kind of work through it later if you do need to.